My name is Cheryl Hicks, and I'm the Executive Director and CEO of the Toilet Board Coalition. We're a business-led platform accelerating the sanitation economy. We've started this video series to share the business solutions that we've been working on over the past 5 years with our business networks, and also to discuss with the experts that are part of the Toilet Board Coalition the sanitation economy, their views on the acceleration of the sanitation economy, on COVID-19 and future outlook. Today, I'm really pleased to have with us Cynthia Ramirez, who is in public affairs with Pfizer Corporation and an independent director at the Toilet Board Coalition. Cynthia, as someone in the health field, it's quite a critical time for you during the global pandemic. I'm wondering if we can start there, since that's what's on everyone's mind. You know, how has the global pandemic, really affected you in the health sector, and what are you seeing in terms of connections between the health sector and the sanitation economy?
Thank you, Cheryl. It's a pleasure to be part of this conversation. I think the pandemic has demonstrated that those kind of things are very real and can touch every part of everyone's life. So it is here. We don't know when it is going to go away, and the impact is really cross-cutting, is strong and unprecedented. For the healthcare industry, really, we are in the middle of it from many points of view, be it the disease, understanding through the science to develop solutions, but also through the understanding of the disease itself and how people can manage it before, during, and after being affected. So it's a massive issue from all points of view. I think the connection to the sanitation issues and hygiene couldn't be more relevant than these times. And finally, people are, talking about washing hands, which seems like an obvious thing, but until now, it has been very hard, I think, to tackle that behavioral issue in many places. Not only because people just don't think about it, but also because of the availability of the resources. So both the relevance of health, as a fundamental part of everyone's life and economies, but also the cross connection with the sanitation that permits or allows to manage health issues and also to prevent health problems in many ways. So the interconnection is really high, and I think the opportunities that this pandemic are going to bring are also going to be really important for all of those working in that area.
Thank you, Cynthia. And I think, as you touched upon, these connections between health, hygiene, and sanitation are starting to become much more visible, having been quite siloed, I think, before the pandemic, and now really seeing the interconnectedness. And what we're seeing from our side is really a call for new solutions that both protect against future threats and build the resilience of these systems for the future. And one of the areas that we've been working on together, you just joined the Toilet Board Coalition as an independent director this year to bring health expertise to our work, and we've really been discussing the smart sanitation economy the most because of the opportunities for the identification of health information and behavior information for public health, in particular through sanitation systems. And I know our work has only started, but would be pleased to hear your observations so far on that work and the opportunities for the health sector.
Yes, I think it's a very important area, and I'm really pleased that it's progressing, and hopefully we will have other partners joining and really contributing, because that's basically the future. Not knowing what's going on with the pandemic, the whole issue with understanding through analyzing the data, collecting data, disease surveillance is really top of the agenda in the or during COVID times, but also post-COVID times. And I think that's for the long term. So it's not something that will only capture attention now. It has captured attention in other infectious disease kind of from other infectious disease angles in the past. But you know, only now the realities we are living are kind of shaking everyone up in a way that is so unprecedented that policies will need to be shaped and put in place that would help kind of drive more of what you know, the connection between the sanitation, digital, and so on can bring to managing disease and to reinforce health prevention and health management, and actually across the board healthcare systems and economies in themselves. So I think it is a very welcome initiative. It has to be recognized, and I hope we will have more you know, organizations supporting, because I think there are also many unexplored areas that we need to be tapped into. So it is really offering a great opportunity to learn more, to contribute, and to really develop the solutions that are tailored to the needs. Remember that you know, COVID is not only prevalent in poor countries, like you know, other types of infectious diseases we have seen in the past. Now we have COVID everywhere in the world, and so the attention span from everyone is really bigger. So we need to, I think, leverage that opportunity and try to connect the dots more strongly and bring the concrete, you know, discussions about what are the solutions, but also what are the gaps that needs to be filled. That's part of the understanding we need to build, right? Because we knew about some gaps in the kind of pre-COVID world, but I think the COVID situation is going to also present to us challenges that, you know, are unforeseen. So we will need to also think about that and help contribute to the understanding of the gaps and how you can tailor that to the new world we are living in.
Thank you, Cynthia. You know, we started the work in smart sanitation when we started to understand that sanitation system to date hadn't been applying some of the digital tools that other sectors have been quick to adopt and benefit from, you know, particularly even in terms of efficiencies, just really digitizing systems gives you information to help you track and monitor and improve the operations and maintenance of the system. And when we started our work in the circular economy and circular sanitation and started to see all of the new value streams that we could derive from toilet resources or human waste, sewage and wastewater, we then started to relook at digitization from that big data point of view. And for the last couple of years now, we have been trying to understand, you know, as you were saying, what are the new technologies that can provide us with new information? Who is that information of interest to, and how can it benefit in particular public health? You know, and then what are the gaps to be filled? And I think that COVID, what we're seeing, as you've said, is really advancing now the interest in that area, because we can trace COVID-19 through wastewater, and tests are being done on sewage as well. And so the role that the toilet board can play there is to really help to connect those dots and help to support the development of that ecosystem by supporting businesses in the sector. I give that brief explanation because this is a public broadcast, maybe for those that haven't been following our work. But getting to sort of to the next question, you know, I think the other real benefits that you bring to the toilet board is your experience in working with accelerator programs. And of course, the Toilet Board Coalition runs the Sanitation Economy Accelerator program, supporting small businesses in low-income countries. Can you tell us, Cynthia, sort of what you've learned about the accelerator program that you've worked with through your work at Pfizer and I believe it's called Accelerate 2030, in terms of what we can learn for our accelerator program in sanitation and sanitation economy?
Sure, that has been a really exciting experience to see all the great ideas that come from countries themselves and the possibilities to address the challenges directly from within, societies. So we worked with the Accelerate 2030 program, which is really seeking at supporting ventures, businesses that are not only providing innovation in themselves, but that are specifically and explicitly creating a connection through the contributions of their business to the Sustainable Development Goals agenda. So it's a cross-cutting, I would say, expertise and exercise that is just fascinating to see the interest really from the grassroots and the kind of ideas that come, and the fact that a lot of these businesses are already progressing. I think the key issue for them has been really how to scale and how to kind of cross borders as well. So that cross-fertilization that, certain solutions might be available, I don't know, in Kenya, but they also help fulfill some gaps that might be prevalent in Colombia. I don't know. So that kind of connectivity between the innovators and the learning experiences that they have brought through that program that we have been working with and has been really fantastic. And I think from what we heard from the innovators themselves, that's one of the key learnings, the connections and the value that they saw for their own businesses and also for themselves as personally, as business managers as well, learning from each other. So that bringing that community together, and it's not only for the year or 6 months that the programs run, but it's really for the long haul. Because once the connections are brought and built, that stays. So that, I think, has been one of the key learnings from that exercise. And we are very pleased to continue partnering with the program organizers at the Impact Hub, and really looking forward to see more of those innovations coming forward and growing. Also tailored to now we're looking at what is happening in the context of COVID, because obviously there is a lot of interest in understanding, how local solutions are also, possible. Mm-hmm. So I think that's what that will be my key message, really, the connectivity and building the community around, those innovators that you are getting together and those businesses. It's not only us as supporters helping them, but it's really also them helping between them and learning from each other.
Thank you, Cynthia. No, it's so helpful, and I think we're starting to hear that as well. We've had many of the small businesses that have been part of our program now, part of this interview series, and many of them are mentioning that now, partnerships between the different companies on the platform, not only the large companies, which is what our program is initiated around, the large company, small company partnerships, but also the small business to small business partnerships. And we also hope in you joining us that we can also connect, those networks of the different accelerator programs as well, mm-hmm. and they can benefit each other from that cross-sectoral learning, and also as we are entering more into the health sector in terms of the work on smart sanitation, that would be really fruitful. And then my final question today for you, Cinthya, is really around future outlook. And I think we're still in the thick of the global crisis. But what have been your observations from your colleagues in the health sector, around what they see to be the new normal in health, hygiene, and sanitation in terms of infection control?
I think going forward, the key issue will be how to build strong surveillance systems, how we can prevent and control disease, and really having lead time so that action can be taken. And in that context, the whole, conversation about digital and data, which of course has a lot of controversial issues in it, but as I would say, policy tool in health systems, in countries, how to integrate that in a way that is appropriate, in a way that really fill the gaps that are needed, and that, as I said, gives enough lead time for policies and action to be taken. And that applies both for the public sector, but I would say from a private sector point of view, understanding disease trends, behaviors is also fundamental for those who are thinking about products and thinking about solutions, business-driven solutions to those needs. So it's the whole ecosystem that is going to benefit. But I mean, it is again a tricky issue because of the notions of like who owns the data, what happens with the data. But provided that the right frameworks are in place, I think that's the issue of the future. And in a way, it's not brand new, right? Because data collection and these discussions have been in the air, but I think COVID has just solidified that in a way that is really kind of unavoidable. All countries are talking about those tracking apps for COVID, and that's like a very topical issue right now, but it's really the issue for the next years to come. And how is that going to shape people's behavior, policy shaping, et cetera, is kind of the big question. But I hope, effective tools will be, devised and put in place that will help everyone to deal better with this kind of situation. But definitely that's for me, the issue of the future.
Thank you, Cynthia. It's been the perfect year for you to join us as an independent director. As we said, as health, hygiene, and sanitation become more visible in terms of interconnections, and also your expertise in working with small businesses, because as you've said, and as we're seeing as well, there's a demand for new solutions, and there is a new normal that we need to plan for, and hopefully our programs in supporting entrepreneurs and innovation can really help with that, and also really happy to have your observations as well on the advancing of digital in the sector, and the advancing of the understanding of the benefits of the data from sanitation systems. So thank you, Cynthia, for these insights today, and we look forward to continuing to work with you. Namaste.
Thank you very much. Thank you.